A silent threat. 5 signs that could indicate high blood pressure. High blood pressure, medically known as hypertension, is a chronic medical condition characterized by elevated blood pressure levels persistently exceeding the normal range. It's crucial to recognize the signs and symptoms of high blood pressure, as it can lead to serious health complications if left untreated. To grasp its significance, let's break down how blood pressure is measured and what it signifies for our health. Blood pressure is measured using 2 numbers, systolic and diastolic. Systolic pressure represents the force exerted by the blood against the artery walls when the heart contracts, while diastolic pressure indicates the pressure between heartbeats when the heart is at rest. A standard blood pressure reading typically appears as systolic over diastolic, measured in millimeters of mercury. So what constitutes normal blood pressure versus high blood pressure? According to medical guidelines, a healthy blood pressure reading falls below 120 over 80 millimeters of mercury. However, when blood pressure consistently exceeds this threshold, reaching 130 over 80 millimeters of mercury or higher, it is classified as hypertension or high blood pressure. The repercussions of high blood pressure extend far beyond numbers on a blood pressure monitor. Persistently high blood pressure places undue strain on the heart, arteries, and other vital organs, increasing the risk of severe health complications such as heart disease, stroke, kidney damage, and vision impairment. Numerous factors can contribute to the development of high blood pressure, including genetics, lifestyle choices, and underlying health conditions. Sedentary lifestyles, excessive salt intake, obesity, stress, and smoking are among the modifiable risk factors that can exacerbate high blood pressure. High blood pressure can affect people of all ages, genders, and backgrounds. However, certain factors can increase an individual's vulnerability to developing high blood pressure. What factors can make someone more vulnerable to high blood pressure? 1. Age. High blood pressure becomes more prevalent with age. As people get older, their blood vessels lose elasticity, and their blood pressure tends to rise. This is primarily due to changes in the structure and function of the cardiovascular system over time. 2. Family history. Individuals with a family history of high blood pressure are at a higher risk of developing the condition themselves. Genetic factors can play a significant role in predisposing individuals to hypertension. 3. Ethnicity. Certain ethnic groups, including African Americans, Hispanics, and people of South Asian descent, have a higher prevalence of high blood pressure compared to other populations. These groups may also experience more severe complications associated with hypertension, such as stroke and kidney disease. 4. Lifestyle factors. A sedentary lifestyle. Lack of regular physical activity and prolonged sitting. B. An unhealthy diet, consuming a diet high in sodium, saturated fats, and processed foods and low in fruits, vegetables, and whole grains. C. Excessive alcohol consumption. Heavy alcohol consumption can raise blood pressure and contribute to hypertension. D. Smoking. Tobacco use can damage blood vessels and increase the risk of developing hypertension. E. Stress. Chronic stress can lead to elevated blood pressure levels over time. 5. Weight and obesity. Being overweight or obese significantly increases the risk of high blood pressure. Excess body weight puts additional strain on the heart and blood vessels. 6. Other health conditions. Individuals with certain underlying health conditions, such as diabetes, chronic kidney disease, sleep apnea, and high cholesterol, are more susceptible to developing high blood pressure. Hormonal disorders, such as thyroid disorders or adrenal gland abnormalities, can also contribute to high blood pressure. 7. Medications and lifestyle factors. Certain medications, such as oral contraceptives, non-steroidal anti-inflammatory drugs, decongestants, and steroids, can increase blood pressure levels. Pregnant women may develop gestational hypertension or preeclampsia, which can lead to complications for both the mother and baby. 8. Socioeconomic factors. Socioeconomic factors, including lower income, limited access to health care, and inadequate health literacy, can also contribute to an increased risk of high blood pressure. It's important to note that while certain individuals may be more vulnerable to high blood pressure due to these factors, the condition is often preventable and manageable through lifestyle modifications, regular medical checkups, and appropriate treatment. Identifying and addressing risk factors early can help reduce the likelihood of developing high blood pressure and its associated complications. Now, let's talk about the signs to watch out for. 1. Headaches. Persistent headaches, particularly at the back of the head, can signal high blood pressure. These headaches may vary in intensity and duration, often described as throbbing or pulsating. They might worsen with physical exertion or stress. In addition to the headache itself, individuals may experience accompanying symptoms such as dizziness, lightheadedness, or blurred vision. These symptoms can significantly impact daily functioning and quality of life, underscoring the importance of monitoring blood pressure levels. 2. Chest pain. Chest pain or tightness, commonly described as a squeezing or pressure-like sensation, can be a warning sign of high blood pressure. It's crucial not to dismiss chest pain, as it could indicate underlying heart problems such as angina or myocardial infarctions, heart attacks. The pain may radiate to the arms, shoulders, neck, jaw, or back. Individuals experiencing chest pain should seek immediate medical attention to rule out serious cardiac issues and receive prompt treatment. 3. Shortness of breath. Difficulty breathing, whether during physical exertion or at rest, may indicate high blood pressure. As blood pressure rises, the heart must work harder to pump blood through narrowed arteries, leading to inadequate oxygen delivery to tissues. This can result in breathlessness, even with minimal activity. Individuals may feel like they can't catch their breath or experience a sensation of suffocation. Shortness of breath can significantly impact daily activities and should prompt evaluation by a healthcare professional. 4. Fatigue. Chronic fatigue or persistent tiredness, despite obtaining sufficient sleep, could be an indication of high blood pressure. The increased workload on the heart due to elevated blood pressure can lead to decreased energy levels and a sense of exhaustion. Individuals may struggle to complete routine tasks, experience diminished productivity, or find it challenging to concentrate. Fatigue associated with hypertension may persist despite rest and relaxation, highlighting the need for medical assessment to address underlying cardiovascular health issues. 5. Irregular heartbeat. A rapid or irregular heartbeat, medically referred to as palpitations, may indicate high blood pressure. Individuals may perceive their heart racing, fluttering, or pounding in the chest. Palpitations can occur spontaneously or in response to physical exertion, stress, or caffeine intake. While occasional palpitations are common and often benign, recurrent or persistent irregular heart rhythms should prompt evaluation by a healthcare provider to assess for underlying cardiac conditions, including high blood pressure. Lifestyle modifications. The effort to combating high blood pressure involves a multifaceted approach that combines lifestyle modifications, dietary changes, regular physical activity, and in some cases, medication. Here's an expanded overview of strategies to manage and lower high blood pressure. 1. Healthy diet. Adopt a diet rich in fruits, vegetables, whole grains, and lean proteins while limiting saturated fats, cholesterol, and sodium intake. Emphasize foods high in potassium, magnesium, and calcium, as they can help regulate blood pressure levels. Follow dietary approaches such as the DASH, Dietary Approaches to Stop Hypertension, diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy products, and has been shown to effectively lower blood pressure. 2. Regular exercise. Engage in moderate-intensity aerobic exercise, such as brisk walking, swimming, cycling, or jogging, for at least 150 minutes per week. Incorporate strength training exercises 2 or more days per week to improve overall cardiovascular health and muscle strength. Physical activity helps lower blood pressure by improving blood vessel function, reducing inflammation, and promoting weight loss. 3. Weight management. Maintain a healthy weight through a balanced diet and regular exercise. Aim for gradual, sustainable weight loss if overweight or obese, as even modest weight reduction can lead to significant improvements in blood pressure. 4. Limit alcohol consumption. If you drink alcohol, do so in moderation. Limit consumption to no more than 1 drink per day for women and 2 drinks per day for men. Excessive alcohol consumption can raise blood pressure and contribute to other cardiovascular risk factors. 5. Quit smoking. Quitting smoking is one of the most effective ways to lower blood pressure and reduce the risk of heart disease. Smoking damages blood vessels, increases heart rate, and narrows arteries, all of which contribute to elevated blood pressure. 6. Stress management. Practice stress reduction techniques such as deep breathing exercises, meditation, yoga, or progressive muscle relaxation. Chronic stress can contribute to elevated blood pressure, so finding healthy ways to manage stress is essential for overall cardiovascular health. 7. Medication. In some cases, lifestyle changes alone may not be sufficient to lower blood pressure to target levels. Your healthcare provider may prescribe medication, such as diuretics, ACE inhibitors, angiotensin II receptor blockers, beta blockers, or calcium channel blockers, to help control blood pressure. It's essential to take prescribed medications as directed and follow up with your healthcare provider regularly to monitor blood pressure and adjust treatment as needed. 8. Regular monitoring. Monitor blood pressure regularly at home using a home blood pressure monitor. Keep track of blood pressure readings and share them with your healthcare provider to guide treatment decisions and monitor progress. Combining these lifestyle modifications with appropriate medical treatment can effectively manage and lower high blood pressure, reducing the risk of heart disease, stroke, and other complications associated with hypertension. It's important to work closely with your healthcare provider to develop a personalized treatment plan tailored to your individual needs and health goals. To learn more about this and other common illnesses, please like this video and subscribe to Cureativity. Thanks for watching, and until next time, take care.